neurology, physiology, and anatomy. All right, so we're just going to be talking about just the side thing is cerebral perfusion, okay? So the way that we perfuse our brain is primarily driven by the amount of carbon dioxide located within our blood, okay? And that's how we sense how much blood should get to our cerebral arteries, okay, in order to perfuse the brain. And this is going to be helpful later on, okay? But first, I'm going to talk about Cushing's reflex. Cushing's reflex is a triad that you're going to see with a patient that has increased intracranial pressure. They're going to present with hypertension, bradycardia, and respiratory abnormalities, okay? And that's going to tell you that there's an increased amount of intracranial pressure, okay? So the reflex is in response to pressure in the brain, okay? So keep that in mind. The three parts of Cushing reflex is hypertension, bradycardia, and respiratory distress or depression, okay? So they'll have a decrease in respiratory rate. The hypertension, honestly, another thing that I realized is that you'll have a widened pulse pressure. So not only will you have hypertension, but you'll also have a large difference in your systolic and diastolic blood pressures along with bradycardia, okay? Now, the reason I said that cerebral perfusion is interesting because it's primarily driven by the carbon dioxide is because patients that have increased levels of intracranial pressure, we can somewhat help that problem by affecting the way that they breathe, okay? So since it's driven by carbon dioxide, we can essentially hyperventilate patients with increased levels of intracranial pressure, okay? And by doing so, when you hyperventilate, you blow off carbon dioxide. Okay, so that leads to an overall decrease in carbon dioxide in your blood, and that will cause a vasoconstriction effect, okay, to the cerebral arteries, and that will lead to an overall decrease in cerebral blood flow. And when we have a decrease in cerebral blood flow, it leads to an overall decrease in the intracranial pressure. Okay, another thing that you can do is just putting the head of the bed up, okay, to decrease intracranial pressure. But hyperventilating the patient is going to work because, once again, carbon dioxide is the primary driver of cerebral perfusion, okay? And it's tightly regulated by that.